Hello, class. My name is Jorge Salomero Bernal, and today I will be presenting population level health education and intervention. So, population health issues. My interventions were based out in Stockton, California, in the 95202 community. I was able to identify disparities in chronic illness management with a focus on diabetes and childhood obesity. It's very interesting that according to the CDC, about 29.1 million people have diabetes, and 1 in 3 children in the United States are either obese or overweight. So some health issues and background. Diabetes. In this community, I was able to see that there are many individuals who do have poor management of diabetes, and as we know, this can lead to significant complications. This includes heart problems, increased chance of stroke, kidney problems, gum disease, nerve damage. Stockton, California is a very impoverished area where many individuals experience health disparities that prevent them from properly managing their chronic illness. Childhood obesity. Childhood obesity is it's very important because we have been noticing that worldwide obesity rate has more than doubled since the 1980s. Childhood obesity can also lead to long-term illness. This includes high blood pressure, high cholesterol, increased risk of type 2 diabetes, breathing problems, joint problems, musculoskeletal discomfort, fatty liver disease. In San Joaquin County, more than 30% of the children are overweight or obese. What are Healthy People 2020 health objectives? For diabetes, they included reduce the annual number of new cases of diabetes, reduce death rate among individuals with diabetes, reduce rate of lower extremity amputations due to diabetes, improve glycemic control, improve lipid control in diabetic populations, increase blood pressure control, increase more foot exams in this population as well, increase the number of eye examinations, and increase the compliance of self-blood glucose monitoring. For childhood obesity, for weight and nutrition, it included increase the number of states that implement nutrition standards for food and beverages for preschool-age children in childcare, encourage schools to not sell or offer high-calorie sweet and beverages to students, increase the number of schools that provide fruits and vegetables whenever other foods are sold or offered, increase primary care physicians to monitor body mass index and provide weight and nutrition counseling, reduce the amount of children and youth that are considered obese, reduce consumption of calories that come from fats and added sugars in individuals age 2 or older. One of their main goals was to promote health and reduce the risk of chronic illness by proper nutrition and healthy weight. So needs assessment for diabetes. There is high Hispanic population in this area, and as we know, there is a link between health disparities and ethnicity. These individuals also might have poor health literacy, poor socioeconomic status, and poor diet. For childhood obesity, this area, as I explained, was very impoverished. They have poor access to healthcare. They have limited access to nutritious foods. In that specific area where I was at, there was no large supermarkets. Everything was, large stores and just fast food, not large stores, but small stores and fast food restaurants. There's also a lack of a safe environment for children to play. This decreases their overall physical activities. And parents at times lack financial resources to promote a proper diet. I mean, it's unfortunate that a salad is $7 when you can get a double cheeseburger for $1 and some change. And then also something that's very important is family customs and cultures. I'm from an Hispanic background, and I know that most of our foods are, not healthy, and a lot of them are fried foods. So the model that I used was the pre-seed proceed model. The initial part of this framework begins with the pre-seed aspect. In this phase, an individual such as me assesses and generates information that will be used to make decisions and interventions for the community. The second part of this model is the proceed. It implements actions based on information that was obtained in the previous portion. So the phase one of this project includes social assessment and situational analysis. I have previously worked in Stockton, California, so I'm pretty familiar with that area and all the health disparities that these individuals experience. A lot of information I did gather as well was from my windshield project. And, you know, at times it was a little scary going into some of these neighborhoods because, you know, it's pretty bad. They have a pretty bad crime rate in that area. Phase two, epidemiological assessment is in this area. And for this phase, I went out and asked community stakeholders about what they believe, what problems they were able to see in the community. And then from what they were able to tell me, you know, I was able to gather a bit more information and made a plan of, you know, what type of interventions I wanted to make for this community. The next is the education and ecological assessment. In this part of the phase, I was able to, you know, see what type of behaviors I can change or, you know, what can be modified in these populations to, you know, be able to progress and, you know, have better health outcomes. Intervention alignment. In this phase, you know, I reviewed my plan, what my interventions were, what my strategy, what my plan was, and see if it was appropriate for the specific community that I was attempting to, you know, promote health and, you know, help them make better choices about their overall health. The next part of the phase includes administrative and policy assessment. In this part of the phase, you know, I had to see what type of resources I had, if there was any barriers, and, you know, what policies or strategies I needed to implement as well. So luckily, I was able to do my intervention at Catholic Charities, and they provided me a lot of resources, a lot of information, and a lot of guidance to be able to complete this intervention. And I would have to say I didn't have many barriers. Next part is the implementation phase. As I explained, I have already completed my 2 interventions, which were 2 educational courses, and I will explain it a little bit further down this presentation. Next one is the impact evaluation. I think overall what I was able to see after those classes was that, you know, a lot of these individuals, you know, they felt at times guilty that they, you know, they did not have a proper diet, that they did not have adequate exercise, or that they're not monitoring properly their chronic illness such as diabetes. And, you know, I did have some individuals who did come up to me and ask me additional questions, and then a few Spanish speakers who just needed a little more clarification. Phase 8 is the outcome evaluation. You know, this is a more of a long-term assessment, and unfortunately, due to the shortness of this class, we can't really get an accurate reading of this. However, you know, I do think that with more interventions and more outreach, we can reach more individuals and help hopefully prevent and promote prevent health complications and promote health. So barriers. Barriers that this community experiences. As I said, unfortunately, the population in Stockton, California does experience various risk factors and health disparities. The total number of individuals living below poverty is about 55.5%. That means that more than half of the individuals here are living below poverty. Most of the population in this community are Hispanics, and according to the CDC, there is a link between ethnicity and health disparities. They have poor access to healthcare services. You know, there's not that many hospitals around this area, or in this area, there was no hospitals. Just outside the borders, there was 2 main hospitals. They have a language barrier, health literacy problems, lack of transportation. They have difficulty purchasing good quality foods. There's cultural beliefs and values, and that might get in the way. And then, you know, some of these individuals might have a self-care deficit. You know, they might have a disability where they're not able to properly manage or, you know, manage their health. They might have cognitive deficits where, you know, they're not able to properly remember to take their meds. They don't understand the importance of their medications. So my two intervention education classes. My first one was on diabetes, and my presentation focused on preventative measures for diabetes and management of diabetes. My goals that my presentation was guided to meet included reduced number of new cases of diabetes, education to prevent diabetes, and this can include diet, exercise, and appropriate weight management. My presentation addressed complications of diabetes and how to properly manage diabetes. This was aimed at the goals of Healthy People 2020, such as reduced rate of death among individuals with diabetes, decrease the rate of extremity amputations, proper glycemic control, and increase compliance of glucose monitoring. For my child obesity presentation, it was guided to encourage proper nutrition, promoting health and decreasing the risk of chronic illness. This is also the goal of Healthy People 2020. Another goal included in my presentation is to reduce the amount of children and youth that are considered obese. Other goals included reduce consumption of high-calorie foods and sweetened beverages. I also included a list of available community resources where individuals can seek assistance and acquire healthy and nutritious foods. Budget and logistics. My presentation was completed at Catholic Charities of Stockton. The staff there were very helpful and they provided me with most of the resources that I required for my presentation. The developmental director was very helpful and assisted me in reviewing the information and provided me additional recommendations. Catholic Charities assisted me in acquiring an audience and provided me all the materials. This included a conference room, computer access, projector, access to the printer and stationery supplies. They also provided me, like some staff that did guide me and, assisted me making changes in my presentation. I was very grateful for this opportunity that was given to me at this agency. The only cost that I required was related to sandwiches that I purchased as a token of appreciation to Catholic Charities staff. So project evaluation, design, and outcome. The goals of my presentation was to provide education to individuals who experience health disparities. I believe that it is very important for health professionals to do outreach and educate individuals about health promotion, preventative measures, illness management, and resources and services that are available in our community. There are various resources and services, as I explained, in our community. However, some of these patients do have a knowledge deficit. They don't know that these programs exist. And at times, they don't attend it because they feel that individuals are going to be biased towards them. Overall, I believe that my interventions were successful. Many individuals stated that they were guilty of not following healthy diets, and they also had a lack of exercise. Other people at the presentation approached me and Catholic Charities staff inquiring about local community resources. Staff at Catholic Charities were able to assist them and direct them to the proper services. In addition, Catholic Charities offers a variety of programs that community members were not aware of. Individuals in my diabetes course had various questions, especially related to health literacy. I am fluent in Spanish and I took my time to educate and provide additional information about diabetes to individuals who requested it. For example, one individual was recently diagnosed with diabetes and was not properly educated on how to use a glucometer. Fortunately, he did have his glucometer in the car. I reviewed the process and had them demonstrate it back to me. He was very thankful. My short-term goals for childhood obesity can include, just following up on if they have made lifestyle changes. This can include a diet and exercise. Long-term goals can include, a decreased weight and a decreased amount of obese children in this community. A significant long-term goal can be decreased chronic illness due to positive lifestyle changes. Fortunately, due to the shortness of this class, we're unable to monitor that. Short-term goals for my diabetic individuals can include compliance with medications and glucose monitoring. This is a great step in making changes for those who are not compliant. And then also a few other short terms can include proper exercise and nutrition. Long-term goals can include decreased amount of diabetes complications, reduced death rates among diabetics, and improved glycemic controls. For example, excellent hemoglobin A1C levels. Results and conclusion. Overall, I think my presentation was great. I was able to identify problems that are occurring in our local community and provide my audience education, health promotion, and information about available and local resources. I think a weakness to my project was the literacy level. I could have made my presentation simpler and with less medical terminology. At times, I would have to explain what certain words meant, for example, glycemic control. Due to the population being largely Hispanic, future projects can be presented in Spanish. This would be very beneficial, and I think it would attract a larger audience. In my personal opinion, I believe that with continued education, reinforcement, and increased health care outreach, we can meet goals stated in the Healthy People 2020. This is the end of my presentation. Thank you for your time, and these are my references. Thank you.